Hello and welcome to our short video on hearing loss. This short presentation will introduce the Audiology Tayside Specialist Adult Hearing Clinic and lay out some important information about your journey so far and some of your options going forward. For many people, hearing will decline in both ears over time at a similar rate. This is referred to as symmetrical hearing loss. However, for some people, the level of hearing loss is different in each ear, meaning one ear hears worse than the other. This is referred to as asymmetrical hearing loss. Relying on one ear to hear is challenging. Difficult listening environments can be more tiring for someone with asymmetrical hearing. Your hearing system is designed to receive input from both ears. This way, it helps us to locate where sounds are coming from and improve overall loudness. If you have this type of hearing loss, you may cope well in quiet, one-to-one conversations, but separating speech from background noise is hard to do when you're relying on one ear to hear. Listening with one ear requires a lot more effort than listening with two. Noticing that you're losing your hearing can be a shocking and unpleasant experience. The way you have always communicated may change. The impacts of hearing loss will differ for everyone. It is very hard to follow a conversation in a busy environment with a lot of background noise when one ear is better than the other. It is difficult to separate the background noise from the sound you want to hear. Some people may have difficulty determining the direction of sound. This can make it dangerous to cross the street or otherwise navigate in traffic. We will discuss all of the relevant support you can access to best manage your asymmetrical hearing loss. Hearing devices focus on restoring the sensation of hearing. You can be fitted with a hearing aid for the poorer ear, a cross hearing aid, a bicross hearing aid. You can be referred for bone-anchored hearing aids. You can choose to use good communication tactics. You may choose to look into specialist equipment for the hard of hearing, which can be used alongside hearing devices. You may choose to contact charities for the hearing impaired, who can provide more information, advice and support. You may choose a combination of these options, which can all be discussed further with your audiologist. There are considerations to be made when thinking about your hearing loss. It may take longer to adapt to your hearing aids compared to someone with symmetrical hearing loss, as your brain will constantly compare the sound from the hearing aid to your better ear, and this can slow down the adaptation process. Communication tactics are very important for people living with hearing loss, and we can provide you with information and advice about this. If hearing aid technology is chosen, you will be made aware that there are some limitations with this technology. Hearing aids cannot replace normal hearing, as they process and amplify the sounds around you. With hearing aid technology, you may still struggle to localize where sounds are coming from. With a bone-anchored hearing aid or cross-hearing aid, you will still only hear sound through the better hearing ear, but should have a better awareness of sound coming from the poorer side. It is important that your expectations of your chosen treatment options are discussed with your audiologist to ensure that you get the most out of your pathway. CROSS stands for contralateral routing of signal. Here the hearing aids transfer sound from the poorer hearing side to the better hearing ear. Cross hearing aids are wireless and give you access to sounds on the side with poor hearing. Cross hearing aids consist of two devices which look like conventional hearing aids. One contains a microphone and the other a receiver. The receiver unit is behind the normal ear, while the microphone system is located on the poorer ear. The sound is picked up through the microphone system located on the side of the poorer ear and sent wirelessly to the normal hearing ear. Bicross hearing aids are used for people who have some degree of hearing loss in the better ear. With the bicross system, both ears have a microphone system, as the better ear also receives amplification. Sound is still only perceived on the side with the receiver, which is the better hearing ear. A bone-anchored hearing aid is a surgical alternative to a cross-aid. This device consists of a titanium screw which is surgically implanted in the bone just above the affected ear, with a small abutment exposed through the skin to which a vibrating sound processor is attached. The vibrations pass through the bones of the skull to the cochlea of the better hearing ear. Outcome for bone-anchored hearing aids and cross aids are usually similar. If this option is suitable for you, your audiologist will explore this further with you. That brings us to the end of this video on asymmetrical hearing loss. We look forward to seeing you again on the Specialist Hearing Clinic. Please note down any questions you have from watching this video, and we will discuss these with you in your next appointment.